I'm Josh Abnelli. I'm doing a talk on cerebral palsy and Botox. Cerebral palsy is an umbrella term that covers disorders that affect movement. It is the most common cause of physical disability in Australia, with 1 in 500 live births. There is no cure for cerebral palsy. The cause is still unknown. There are, however, factors that can increase the chance of a child being born with cerebral palsy, known as a causal pathway. Premature birth, low birth weight, placental issues during pregnancy, maternal infection during pregnancy, oxygen deprivation during birth, socio-economic status are all factors that can increase the chance of a child being born with cerebral palsy. Over the age of 1 month, the most common cause in infants is stroke. Cerebral palsy is any number of brain defects, including brain lesions, brain abnormalities, or incorrect development. Cerebral palsy in no way affects the cognitive function of people diagnosed with it. However, it does increase the chance of a person diagnosed with it having a cognitive impairment to 1 in 2. Spasticity is the most common symptom present in 70 to 80% of cases. Spasticity is increased muscle tone and tension in the muscle. This is caused by damage to the corticospinal tract or the corticobulbar tract, usually in the motor cortex. The damage causes excessive stimulation of muscles by the continual firing of action potentials through either of these two tracts. The constantly activated muscles are painful, develop hypertension, and lead to physical deformity and incorrect limb movement. These two pictures are of Aquinas gait, characterized by hypertonia of the gastrocnemius and soleus, causing the abnormal foot position and requiring patients to use a walking frame or wheelchair. Botulinum toxin type A, or Botox, is synthesized from the bacteria Clostridium botulinum. It is not a cure for spasticity. It only works to inhibit acetylcholine release at the neuromuscular junction. In a normal neuromuscular junction, an action potential reaches the axon terminal. It causes calcium channels to open and calcium to bind to synaptotagmin. Synaptotagmin then binds to a protein called synaptosomal associated protein 25, or SNAP25. SNAP25 is bound to the inner membrane of the axon terminal. After the binding of SNAP25 allows for the exocytosis of acetylcholine to diffuse across the synaptic cleft and then to go on and activate the muscle. Botox works by selectively binding to the cholinergic nerve ending, and then the toxin is diffused into the cell. The toxin then cleaves SNAP25. As such, synaptotagmin and vesicles containing acetylcholine can no longer bind to the protein and membrane, and cannot diffuse across the membrane. In layman's terms, Botox inhibits the nerve signal from being transmitted to the muscle. Botox is most commonly used in cerebral palsy to aid with walking. So much so that the gastrocnemius is the number 1 muscle that undergoes treatment. The gastrocnemius enables toes to push and spring. It is also involved in bending the knee. Botox is injected deep into the muscle tissue in multiple locations to optimize its effectiveness. Spasticity requires greatly higher amounts of Botox than cosmetic applications for it to be effective. Botox does have a side effect of leading to small muscle mass where it is injected. This is to be expected, however, due to the nature of the drug. Children with spasticity known as Aquinas gait have a constantly activated gastrocnemius leading to physical deformity. Injecting substantial amounts of Botox with physical therapy allows for the muscle to relax and a more normal walking gait. The effects last anywhere from 3 to 6 months, after which injections are required again. Botox reduces hypertension in the muscle, relaxes muscles, and allows for more normal limb function and control by the patient. It can also alleviate pain associated with spasticity. In summation, cerebral palsy is a neurological disorder that affects movement and is most commonly associated with spasticity. Botox is an effective drug that alleviates spasticity, has minimal side effects, and can drastically improve the quality of life for patients. More research is required, however, to prevent cerebral palsy and to help create a cure that can be effectively applied